Even though suicide prevention interventions by the Ministry of Health over the years has led to a reduction in the country's suicide rate, which once stood at 44.2 per 100,000 in 2012, this serious public health problem continues to prevail. Guyana's suicide rate in 2018, according to officials from the Mental Health Unit, was 18.88 per 100,000. However, since then, updated data has not been available. Shane Tull, a US-based Guyanese psychotherapist, during a sit-down with Nightly News on Tuesday, weighed in on some measures public health authorities can take to reduce the incidence of suicide in Guyana. He believes consistent public awareness strategies targeting both adults and school-aged children should be undertaken to create awareness of depression as treatable and suicide as preventable. He noted that a comprehensive approach to suicide prevention should not only include efforts from government health departments, but should be supplemented by non-governmental organizations, religious bodies, and members of the private sector, among others.
It definitely takes everyone being on board, from the churches, the synagogues, the mosques. Everyone need to be part of the conversation, so it could be at the forefront, and that's how we learn collectively, and also how we support each other. Mental health is community health.
Society, too, he says, can play a vital role in preventing suicide. Tull underscored that there are no clear indicators that suggest someone's intention to commit suicide. In most cases, their unhappiness is masked, but if they are committed to follow through with the act, they will do so when it is least expected. The suicide phenomenon, according to Tull, is further made complex because society may notice changes in an individual's behavior, but avoid asking about their well-being. He believes that these conversations have the potential to save lives.
We live in a society where we don't want to get into people's business and ask them certain questions. But if you know, so let's say you have a coworker that comes to work on time all the time, very jovial, very engaging, and in the last month you see this change in their behavior. They're coming to work less, somewhat tardy and not dressed properly, getting into arguments with everyone, and this is just not who this person is. That's the time to have a conversation with the person.
Suicide and depression are serious interrelated public health problems. Although the majority of people who battle depression do not die by suicide, having major depression does increase suicide risk. The government of Guyana in this year's national budget designated $39 million for the extension of the mental health facility at the Georgetown Public Hospital. Another $50 million were allocated for training, including specialty areas such as addiction and rehabilitation. In addition, consultations on the Mental Health Act of 1930 will be held, following which it is expected to be revised and tabled in Parliament for consideration later this year. Tull will on Wednesday venture into a 2-day mental health course for local healthcare practitioners, which will be held at the Green Place Kitty. The event is intended to provide the participants with tips in demystifying myths surrounding mental health. Temika Rodney reporting for the HGP Nightly News.